And then the folks on our team, if you want to go ahead and disable the waiting room so folks can just join without having to wait.
Yeah, it's disabled.
All right, excellent. All right, looks like we have everyone who is in the waiting room on the webinar now, so we will go ahead and get started. Welcome everyone to the High Road Training Partnerships Healthcare Application Webinar. Go ahead and go through the agenda here. Just a moment. Here's the agenda for today. We'll go through some introductions of the California Workforce Development Board team, provide an overview of the grant program. Khan is on the call to do a walkthrough of the Cal eGrants application. Then we will move to grant resources and end hopefully with about 30 minutes at the end for Q&A. Just a little housekeeping before we get started. If folks wouldn't mind keeping their audio muted during the presentation to reduce background noise. You all are free to use the chat throughout the presentation. Our team will try to answer any questions that you have if they're more straightforward directly in the chat. If not, we will queue up those questions for the Q&A section. If folks have questions after today's webinar, please feel free to send those to our team at that email, solicitations@cwdb.ca.gov. Folks who want a copy of today's PowerPoint slides, please send an email requesting that to the same email. And I do want to note this call is being recorded. We will be posting this video to the CWDB YouTube channel, and a link will also be available on the HRTP Healthcare Grant webpage. So we'll do intros of the team here. So I'll start. My name is Mike Rosetta. I'm branch manager over the grant development and selections and agreements unit. And I will pass it to Monique.
Thank you, Mike. Hi, everyone. Good morning. I'm Monique Cardona. I am a grant development and selections analyst here with the solicitations team, and I will pass it over to Julissa.
Good morning, everyone. My name is Julissa Silva, an analyst for the solicitations team, and I will pass it over to Kristen.
Good morning. I'm Kristen McGuire, and I am the Grant Development and Communications Analyst for the solicitations team, and I will pass it over to Courtney.
Good morning. I'm Courtney Walker. I'm a Grant Selections Analyst with the solicitations team, and I will pass it over to Phyllis.
Morning, everyone. I'm Phyllis Jeffrey. I'm a research specialist on the Policy, Legislation, and Research team, and I'll pass it over to Matt.
Hi, my name is Matt Wutch. I'm the program manager for the HRTP team, for one of the HRTP teams, and will be the program manager for this grant initiative. And I'll pass over to Kara.
Hi, I'm Kara Meyer, and I am the supervisor for the grant contracts team. So I'm in charge of processing the agreements once they're awarded. Is there anybody else, Mike?
Con,
Con.
go ahead.
Sorry, Con.
No worries. Hello, everyone. My name is Con Lamb, and I'm with the County Force team, and I'll be presenting you guys with a quick walkthrough of the application later on in the presentation. Back to you, Mike.
Thanks, everyone. Monique, take it away.
Thank you. So good morning, everyone. We have for you a $28.5 million funding opportunity with HRTP-HC. This, our intent is for projects that will connect workers from target populations to high quality, middle skilled jobs in the healthcare sector. All awards are going to be given in a single grant cycle that's including for all three project types. The grant term for this funding opportunity is 18 to 24 months, depending on which project type you apply for, with an anticipated start date of July 1st of next year. And the due date for the applications is going to be November 12th at 5 o'clock. So for some of you, I know HRTP might be really familiar, but for those that are new to this, HRTP is characterized by 4 essential elements. We've done this for every round in the past, I believe. We have design quality jobs. We have ensure equity for workers, amplify worker voice, and invest in environmental sustainability. Partnerships in HRTP are always characterized by the inclusion of at least one training provider, one worker voice representative, and one employer. And in the RFA, these are referred to as required partners. And just some background, to date, the CWDB has awarded over $200 million throughout the state, and there's been over 88 HRTP projects, which I'm sure we'll get into a little bit later. So I'm not going to go too deep into the project types just yet, because I know we're going to dive a little deeper in a little bit. But these are just the three that we've used also in previous cycles. We have planning and development, we have training implementation.
Some swimming goggles.
And we have expanding.
They want
different grant terms for each project type. So for planning and development, the grant term is up to 18 months. I'm sorry, that looks like a typo. I believe it's 12 months. And then for training and implementation, it's up to 24 months. And again, we'll go into that in a little bit, a little more details. So this is just a slide background on HRTPs in the healthcare sector. So to date, the CWDB has already funded 23 healthcare projects and invested over $85 million just in the healthcare sector alone. So I want to shout out to Matthew on our program team, because this is a beautiful, high quality resolution map of all of HRTPs across California. I believe this map is also on the HRTP webpage. There's a map, there's the website address also, but there's also an icon on the main HRTP webpage if you want to get to this. And I believe with that, I'm going to pass it over to Dr. Phyllis Jeffries to talk to us a little bit more about the essential elements and how they look in practice.
Monique, I don't get Dr. Jeffrey a lot these days, so I'll take it, you know. But thank you. So basically, the four essential elements are design quality jobs, you know, by which we mean jobs that provide family-sustaining wages, benefits, a pension or otherwise, you know, retirement benefits, meaningful advancement opportunities, and also worker input, as well as stability, predictability, safety, and jobs that are free of discrimination. By equity, we mean, and I should pause and say, I have a feeling that I'm sort of preaching to the choir here, but I do want to sort of walk through these and then talk about how, on the next slide, about how we kind of envision them being operationalized or put into practice. So equity, we are really talking about how, you know, access to the means of economic security is not fairly distributed in our society. They're due to legacies of past and ongoing discrimination that lead to stratification in who has access to opportunities for education, training, and good jobs. So in healthcare, I think, as we all know, that means, you know, overrepresentation of persons of color, women in lower paying jobs, and often blocked upward mobility to those better paying jobs. So we are, you know, interested in projects that are actively correcting those inequities through pathways and also through, you know, the formalization of credit for existing skill sets, existing experience, you know, existing education. Worker voice. This means that workers are able to participate in decisions affecting their livelihoods. And in the projects, it concretely means, on the one hand, that you are that applicants are partnering with a worker representative, such as a labor union, a worker center, labor management, some form of labor management partnership, and also, you know, working with high road employer partners who prioritize a high retention worker investment model that allow you know, meaningful channels for worker input and voice, and also have, you know, good labor practices. Environmental sustainability. So in a healthcare context, um, we're thinking about this as taking potentially a variety of forms. So increasing the number of workers in healthcare workforce in those areas where climate-related health impacts are prevalent, which often tend to be areas that are of the state that are most impoverished as well. And we included a couple of tools from the California Department of Public Health and also the California Office of Environmental Health Hazard, or also we also included the CalEnviroScreen tool that sort of demonstrate the where sort of those priority populations exist in the state. And it can also refer to trainings that, plan for or anticipate healthcare's role, in the face of some climate change related or environmental related, crises. For instance, changes to the first responder role of healthcare workers, due to climate change, for example. Let me go to the next slide. So and I apologize that these are national, not California specific, but just a really quick snapshot, kind of, I think everyone is already aware, but demonstrating those inequities, in this case, racial and ethnic inequities in access to those higher paying jobs in healthcare. So obviously, the higher up the pay scale you go, the fewer the larger the percentage of workers who are white. So we kind of display some of those existing inequities in the healthcare workforce. You can go ahead and move to the next slide. Okay, and then so I think the thing that's kind of new in this RFA is this idea of thinking about how those 4 principles can be put into practice. And we have sort of developed these 4 strategies, concepts or strategies of how those principles can be attained. And so they're not mutually exclusive, but the concept of lifting all workers to the high road, is referring to projects that really provide support services that address the pre-employment needs of job seekers, things that, housing, childcare, transportation, those non-employment services that people need, especially barrier populations need to be able to, think meaningfully about employability. That second category, professionalizing precarious work, is sort of talking about, not just providing pathways from, say, lower paying healthcare occupations to higher paying. That's a part of it, but really trying to address the job quality shortcomings of those kind of existing direct care jobs in healthcare, especially, and how this is kind of where that partnership with employers who have good labor practices, partnerships that include a worker representative, come into practice, or come into play, that is. Working with employers to increase the demand for certification in occupations that might be sort of under-professionalized, like in direct care. So, and I have a kind of a more thoroughgoing example, I think in a next slide, but let me just go through kind of the rest. That notion of democratizing access is kind of the, creating meaningful pathways into those higher paying or more secure jobs, be it, in nursing or, sort of further up the pay scale in healthcare, to reverse those existing inequalities of who has access to those jobs. Participatory planning is basically, this may come into play for the applications for planning grants, which I think the rest of the team will talk about more in a bit, but it's this notion of, labor or worker representatives, employers, training and education providers, all in the room to kind of design curricula and talk about planning for jobs that meet the needs of workers, patients, and employers. You can move to the next slide. Okay, so yeah, so just to be a little more concrete, and again, these aren't meant to be mutually exclusive, but just sort of complementary strategies. But under that heading of professionalizing precarious work, we might think about in again those lower paying roles, say nursing assistants, for example. That's really where that partnership with those high road employers or employers committed to a sort of worker investment model, let's say, of employment really kind of comes into play. So those non-monetary aspects of job quality in particular, which the RFA goes into a bit more. I have some listed there. And I would also put, we have some of the occupations that are called out in the RFA as being in demand are also those sort of community related or sort of, healthcare, but also community roles, peer counseling, community health workers, where, in the past, perhaps have sometimes been in a voluntary capacity or not always very sustainable pay. And so there's kind of an interest in, trainings and certifications that help, again, increase the demand for, well-paid professionalized workers in those jobs. You can move on to my final slide in this section. Sorry, the print's a bit small, but yeah, I guess another example for that kind of idea of democratizing access is, where we're thinking about meaningful mobility for healthcare workers who are incumbent, in some healthcare role. So, for example, the apprenticeship training CNAs to become LVNs, or bridge programs for LVNs, licensed vocational nurses, to become RNs. And here, again, the focus is on programs that allow people, that take away that false choice of having to choose between, do I pursue my education training, or do I actually earn enough to pay rent or what have you. So, whether that's by sort of simplifying the process of transferring credit already earned at a community college, such as in those LVN to RN bridge programs, or, counting hours worked, accommodating coursework and training around existing job schedules, say for CNAs. And then, those goals are sort of that win-win-win for workers, job seekers, workers, employers, who will have seen through the training and don't kind of face those uncertainties of hiring as much as they might otherwise, and then recruitment. And then, patients for whom there's plenty of research to show the value of ethnic concordance and cultural competency for, a healthcare workforce that's more representative of patients, for patient outcomes. Again, I feel like I'm probably, from a place of relative ignorance compared to many of you, preaching to the choir, but hopefully that helped illustrate kind of what we mean by those strategies. And with that, I'm going to pass it over to Mike.
Thanks a lot, Phyllis. So now we're going to dive into some of the guidelines, requirements, and priorities of the HRTP healthcare grant. So starting with priorities, if it weren't evident, this is a healthcare sector only grant opportunity. So if there's folks who are interested in HRTP funding outside of healthcare, there will be a grant opportunity for those projects next year. But the focus for this particular opportunity is the healthcare sector only. Funding for communities that need it most, which we'll detail a little bit more in the upcoming slides. Alignment with state and federal investments, activating projects that are implementation ready, and a focus on projects that bring new workers into quality jobs. So again, starting with the industry focus, we seek to fund healthcare projects that lead to quality jobs that pay good wages, offer opportunities for career advancement, and create or strengthen pathways to economic security and upward mobility. California's healthcare sector is comprised of a wide range of occupations, ranging from jobs that pay just above the minimum wage to those that offer high salaries and employer-paid benefits. So within the healthcare sector priority, we have identified 5 priority occupation types. Before I go through those, I do just want to note that there is a priority that's reflected in the scoring criteria, which Courtney will cover later in today's presentation. However, these are not the only project types we seek to fund. And in fact, we, in all likelihood, will fund projects that do not meet these occupational priorities. But these particular occupational priorities identified on this slide were identified by the Healthcare Access and Information Department, otherwise known as HCI, as well as our partners at the Labor and Workforce Development Agency. So again, these occupational priorities are detailed more in the RFA, so I would encourage folks to take a look at the descriptions in the RFA. But we do seek to fund projects that are licensed vocational nurse to registered nurse bridge programs, peer support specialist training programs, substance use disorder counselor training programs, community health worker certification and training, as well as direct care workers. Our next priority is funding for communities that need it most. So what does that mean? Grant applications will be assessed on their ability to effectively demonstrate the need for services in their identified region. And as folks get into the application, you'll find that there are prompts. There's an entire exhibit dedicated to demonstrating demand and then connecting the project activities to responding to the demonstrated demand for programming. So in your applications, we encourage you to identify distinct regional factors that may disadvantage workers and prevent them from achieving their full economic potential. And then we do provide resources for folks to quantify demand in the Appendix B of the RFA. So folks are free to use those resources or other external resources to quantify the need for the proposed services. So I mentioned there's a prompt, there's an exhibit that will prompt applicants to demonstrate demand and opportunity for the proposed activities. That exhibit is called the Strategies, Outcomes, and Indicators exhibit. And we'll show you a screenshot of that here shortly. But we'd like successful applicants to define and quantify service gaps among their target population in the communities they plan to serve, and then connect those gaps to strategies, outcomes, and indicators. And we will define those terms here shortly. We encourage applicants to customize proposed strategies in a way that responds to the unique needs of the region's workers and employers. So starting with strategies, these come directly from the California Unemployment Insurance Code that defines the term high road and defines HRTPs. So high road strategies include, but are not limited to, interventions that improve job quality and job access, including for women and people from underserved and underrepresented populations, strategies that meet the skill and profitability needs of employers, and strategies that meet the economic, social, and environmental needs of the community. So what do we mean when we say outcomes? Outcomes should answer the question, what are the intended results of my strategies? Strategies should connect to clearly identified outcomes that are measurable and tied to one or more indicators. So what do we mean when we say indicators? Indicators should answer the question, how will my project demonstrate whether its strategies are successful? So indicators should seek to capture how strategies and outcomes will benefit workers, employers, and the community where the project is taking place. And I will note in the RFA, we do include examples of strategies, outcomes, and indicators. Those are just examples. We encourage applicants to submit their own strategies, outcomes, and indicators that correspond to the the proposed project, the demonstrated need for services. So here is that exhibit that you will find in the Cal eGrants application. Con will do a walkthrough of the functionality of this, but I do just want to cover this very quickly. For those who have applied for HRTP in the past, you may be familiar with what was previously known as the Outcomes and Deliverables exhibit. So we've expanded on that framework to include prompts for applicants to connect the gaps and opportunities that they'll identify in the application narrative questions. So you'll see at the top in the column headers from left to right for each of the 5 required prompts, and you could see 3 of them here. There's 5 total prompts for applicants to demonstrate gaps and opportunities in the leftmost column, then identify their strategies to address the gaps and or opportunities, identify outcomes of their strategies, and then provide indicators for how those outcomes will be measured. I will note that applicants will also have the option to identify additional strategies, outcomes, and indicators in this exhibit, but there are 5 required. We do strongly encourage folks to identify additional strategies, outcomes, and indicators as well. And again, Con will kind of go over the functionality of how this will actually work in practice in Cal eGrants. So our next priority is alignment with state and federal investments. CWDB seeks to ensure a coordinated response to reaching the state's economic goals. So applicants should seek to identify relevant ongoing workforce planning processes or projects in their respective regions that align with your project's goals. And then it follows that applicants should seek to align their HRTP programming with those comparable workforce funding streams. There is a match leverage requirement, which we will discuss in a few slides, but we encourage folks to identify federal, state, philanthropic, and or private sector investments that align with their project's goals and will function to maximize their project's impact. So our next priority is activating implementation-ready projects. So we seek to support training, implementation, and expanding projects that have completed planning and development activities, as well as having established formal partnerships between the HRTP required partners and are ready to start training participants. So previous HRTP grantees that have successfully completed planning and development activities will receive a priority consideration for training, implementation, and expanding applications. I will note that applicants do not need to have been previously funded to do planning and development under a CWDB grant to be eligible. There's a small priority, which you'll see in the scoring rubrics, but we welcome applicants to the training, implementation, and expanding project types, regardless of whether they have been funded by us in the past to do planning and development. And then lastly, just note that this priority does not apply to planning and development. Planning and development are sort of, that project type is intended to have projects become implementation ready. So there's no expectation that new planning and development applicants have conducted comprehensive planning and development activities prior to applying. Our next priority is a focus on new workers. So at the CWDB, we seek to increase the number of new workers in high quality middle skill healthcare occupations. Projects may propose training for incumbent workers, but there is a priority for projects that are intended to increase the number of new workers in quality healthcare jobs. These projects will receive preference. There are fields in the application to identify the number of new workers versus incumbent workers. So we do encourage applicants to try to push for new job placements in their programming. This list here is a kind of includes but is not limited to list of potential organization types that are eligible to serve as lead applicants. Again, this list is not comprehensive. The one thing I do want to note, and haven't looked at the chat lately, but I know we oftentimes get questions, is my organization eligible to serve as a lead applicant? As a general rule, the only type of organization that is categorically not eligible to serve as a lead applicant is a for-profit entity. And of course, employers are a required partner. So for-profit entities can serve as partners to an HRTP project. However, they cannot serve as a lead applicant. Moving to required partners. Every HRTP must have these 3 required partner types as part of their partnership. So starting with training providers, these are organizations that have the capacity to provide education and training programs to participants. Again, planning projects are not necessarily required to serve participants, but they do need to have a training provider on board. The next one being worker representatives. These organizations are independent of employers, and they contribute to helping shape training programs and training curricula, train and mentor others, and function at the center of developing industry solutions. And then last but not least, employers. Employers understand the workforce needs unique to their industry and identify opportunities for hiring, upskilling, promotion, retraining, and problem solving for future demand. And I will note each HRTP is going to look different in terms of their partner roles, but these are sort of the foundational sort of kind of high-level overviews of the roles that these partner types generally do play in an HRTP. And I do want to just ensure that everyone understands that each one of these entities should be a unique entity. So a single organization cannot serve in multiple required partner roles. And we will have a technical review after we receive applications, and applicants that do not identify each one of these partner types will not advance to the review and scoring phase. So building on the required partners, a key component of this grant solicitation and the HRTP program overall, applicants need to provide evidence of formal partnerships among the required partners at the time of application submittal. So applicants for training, implementation, and expanding projects are required to submit signed memoranda of understanding. We'll use the term MOUs for the rest of the presentation. So those 2 project types are required to submit MOUs for each required program partner. So the minimum requirements for the partner MOUs include the name of the proposed HRTP project or partnership, a description of the roles and responsibilities the required partner agrees to perform as part of the project, and a signature from an authorized representative of the organization on the official letterhead of the signatory's organization. The requirements for planning and development applicants are a little lighter. Kristen, we can just go back to that slide for a second.
Right.
So planning and development applicants don't need to submit signed MOUs that detail their partner's roles and responsibilities. They do need letters of support, however, from each proposed partner that signals their partner's readiness and willingness to participate in the planning and development process. I strongly encourage folks to read the requirements in the RFA. The RFA goes into a lot more detail on this requirement. And this, again, applicants that do not submit all the required evidence of formal partnerships will be disqualified prior to the reading and scoring phase. So we'll just go over some scenarios for the MOU requirement. The MOUs will look a little bit different depending on the lead applicant. So HRTPs in which the lead applicant is a training provider, that training provider does not need to submit an MOU or letter of support on behalf of their own organization. The application itself functions as the commitment to the project. However, training provider-led projects will need to submit an employer partner MOU and a worker representative MOU. So a minimum of 1 MOU from each of those partners. For projects led by a worker representative, again, the worker representative will not need to submit an MOU on behalf of their own organization. they will need to submit a employer partner MOU and at least one training provider MOU. And we'll go through where these MOUs should be submitted in the application in a few minutes. The third scenario, this may be a little less common, but we did want to address this as well. This scenario is one in which none of the three required partner types are serving as the lead applicant. So the lead applicant themselves is not a worker representative or an employer training provider, excuse me. In this scenario where the lead applicant is serving just sort of as a core convener for the partnership, this will require MOUs or support letters from the three required partner types. So you could see here, employer partner, worker representative partner, and a training provider partner. And I'll just note, again, since for-profit entities cannot be lead applicants, there is no scenario allowable where an employer, assuming they're a for-profit, would be eligible to serve as a lead applicant. Just those two, training provider, worker representatives, and this scenario here where a convener is serving as the lead applicant. And then I believe, Monique, I'm turning it back to you here.
Thank you, Mike. So we're going to go and talk about project types a little more in depth now. So we previously mentioned there are three project types available: planning and development, training and implementation, and expanding. I do want to clarify the grant term for planning and development is 18 months, up to $500,000 requested. And again, these are projects that require funding to complete the project design work and achieve training implementation status at a later point. Training implementation projects are delivering the training programs to achieve employment and/or career advancement outcomes. These projects may also include some planning and development alongside training components, and up to $3 million can be requested for this project type. The grant term is up to 24 months, or is 24 months. Training and implementation projects also require leverage. So we'll talk a little bit more about that in the next slide. And lastly, expanding projects are for existing HRTPs or in an existing industry partnership that can demonstrate it meets HRTP's elements or is expanding the partnership and program work. Expanding projects have already demonstrated success in achieving their training outcomes and should be focusing on scale and or replication. Up to $5 million can be requested for these project types, and the grant term is 24 months. And again, this project type does also have a leverage requirement, which I believe we're going to dive into on the next slide. So applicants applying for training implementation and expanding projects must leverage proposed HRTP funding with external non-CWDB resources. There is no leverage requirement for planning and development applications. However, those planning applicants that can demonstrate cash or in-kind leverage will receive funding priority. So let's talk about what we mean by match and leverage. So leveraged resources include both non-cash or in-kind and cash contributions that are to be used by the grantee or a subrecipient contractor to support the proposed project's activities. This may include a cash match. We've linked to a workforce directive here. In fact, all of these workforce directives can also be found in the RFA if you want to get into the weeds on them. WIOA funds may be used as leverage, but not as a source to make a cash match. All leverage funds have to be reportable and are subject to the reporting requirements contained in Workforce Services Directive 19-5. There's a link to it here, and it is also linked in the RFA, so there's no surprises. Next slide, Kristen. Thanks. So I'm going to talk a little bit about project sustainability and kind of why we are including the leverage as a requirement for those project types. So a key objective of HRTP funding is to establish and expand partnerships that continue to operate beyond the grant term. For those that are familiar with HRTP, this is a budget line item that is subject to the budget cycle every year. So we want to lift these projects up so that they can exist long term. Applicants should seek to align their proposed programming with comparable workforce funding streams by leveraging, as Mike mentioned, federal, state, philanthropic, and/or private sector investments to maximize their project's impacts. Also, awarded grantees may be asked to develop and submit a sustainability plan that details and operationalizes the project sustainability strategy as a deliverable prior to the end of the grant term or grant closeout. And I'm going to talk a little bit about our target population. So we are looking to serve English language learners, homeless or housing insecure, immigrants, justice-involved individuals, people with disabilities, veterans, youth, immigrants and refugees, low-income workers, and other resource communities. Under-resourced, I'm sorry. And I'm going to pass it over to Courtney now to talk about our application submission for this grant.
Thanks, Monique. So starting with application submission, all applications must be submitted electronically through the Cal eGrants webpage, and I'll drop the link in the chat in just a minute. Only electronic applications submitted through the Cal eGrants website will be considered, and paper applications will not be accepted and will be automatically disqualified. And I'm going to put that in the chat. Okay. And now I'll move us to the application elements. Applicants must complete and include each of the following application elements to be considered for funding. This includes the cover page, project narrative, strategies, outcomes, and indicators, work plan, participant plan only for implementation and expanding projects, partner roles and responsibilities, expenditure plan, budget narrative, supplemental budget, budget summary, upload documents. And it's important to note that the Cal eGrant system will not allow an application to be submitted if the required fields are not complete. And I will pass it over to Con for the Cal eGrants application walkthrough.
All right, I'll go ahead and share my screen now. Is everyone able to see my screen? Perfect. Okay, so once you log into your Cal eGrants account, you'll be brought to your homepage here. So from here, you can locate the grant in two ways. You can either click on funding opportunities or just the CWDB button here. Once you click that, you should be brought over to all of the CWDB applications that are accepting. You'll see the status of accepting applications. And over at the very top, we have our HRTP that's accepting applications at the moment. If you are missing any of this here and you don't see it, all you have to do is go down here and click this drop-down arrow and make sure you are selecting the CWDB funding opportunities and not on any of these other tabs, and you should be able to see it. Once you've located the grant you're trying to apply for, just click onto that. This will give you a quick overview of the grant itself, and you would just click this apply button at this very top. Once you click that, we have 3 categories that the team have previously mentioned to you that you can select. And keep in mind again that you're able to only select one of these grant applications at a time. So if you have one that's already in progress, you would not be able to start another application. So once you've selected the category, you would just go ahead and fill out this cover page here. Keep in mind, obviously, all of this information is fake data that I'm entering in. And should you ever have any questions about what the data is requesting from you, there's this little icon button here. That's the help bubble. If you hover over it, it will give you a quick overview of what is requesting from you. Since this is just healthcare, this is going to be populated for you, and you won't be able to select any other industries. Go ahead and fill out all fields. And keep in mind the signature down here is just a typable field. So all you would have to do is just retype the name in. Once all of the information has been filled out, you would just go ahead and click that save button down here. And it'll have a little button here that says your application is being submitted. I'm sorry, created. And you will be brought over here to your cover page. From this cover page, if you feel like there's any data that needs to be revised, we do have a pencil icon here that you can click on to edit. And then you can edit any of those editable fields and just make sure to hit the save button again once you have made those edits. Once those edits have been confirmed, you do need to read this acknowledgement here and click the I agree button. If you do not select this I agree button, you will not be able to go on to any of the other narratives or any of the other sections. So select that I agree button up here, confirm that you would like to proceed. And from here, you will be able to go to each section here and input all of your information and all of your narratives and data. Again, keep in mind that each of these fields do have a 3,000 character limit. So be sure that your narratives are below that, or you will not be able to save. Another good practice is also once you've completed each narrative and section, go ahead and click that save button each time, because if for some reason your computer freezes out or you're timed out of the system, your data will not be saved and you will have to re-input that data again. So just make sure you input everything in as required. And just hit that save button each time. Once that's been completed, you would just go on and move on to every section and complete all the required data. As stated here, you would just input all of your information. And same practice, select the save button each time so that you have your data saved so that you don't lose any of that information. Over here, we already have some that's included in here, but should there be additional information you want to add, there is this add button down here. You would just click that for each row you want to add and input as much as you need to. And should there be too many, or if you want to remove any, we do have the trash icon right there. Just go ahead and click that trash icon to remove that. Again, you just move on to each section. And the same apply here, where if you go into each quarter, we have the add button there. Go ahead and click that add button, add any of your necessary data here. And should you need to remove it, go ahead and click that trash button right there. And again, this participating plan will not appear if you did choose participation and development, as that is not required. So that would be the only one that would be missing if you did select that category. Input all the required data as needed. For training purposes, I'm not going to go through each single one for everyone's time. Budget narratives. Again, the add and delete buttons are there for anything that needs to be added and removed. And then we go through the budget summary. And then at the very end here, we have our option here to upload documents. If you don't see an upload document, that tab here, all you have to do is click that more button right there, and it will have a drop down for you. So click that upload documents, and it will bring you over to this section here. These are the categories that are already previously inputted for you per the team's requirement. To input, upload the documents, you would just click this upload button here. And from here, you would just select the document that you would like to upload, open it, and once it's complete, you'll get that green checkbox. From here, this naming convention will now change into a hyperlink, and that is the document that you've uploaded. If there are any additional documents that you need to upload other than these 5 categories that are located here, all you would click is click the new button here, input the document name that you want to input, select the document type, and if there's a brief description, you can go ahead and input that, select the save button, and a new category will appear here for you. And same thing, you would just click that upload button and select the file that you would like to upload. Once everything is completed, you can go ahead and hit that submit button to submit your application. If there's any missing information, such as this one, since we have so many missing data, if you hit the submit button and confirm, it will tell you every section that you've missed. So you can go back to those categories and input any of those missing data. For training purposes, I've already created one. We're going to go ahead and hit that submit button. If all required documents and information has been uploaded and inputted, it will allow you to submit your application successfully. And from here, it will change your process to application submittal. If you would like a paper copy of this, all you would do is click this print view. And from here, you would just right click on this page here, and you will be able to print this copy and have a physical copy of it. And that is the quick overview.
Thanks, Con.
No problem. Stop sharing.
All right, just give us a sec to bring the other PowerPoint back.
Can you see my screen?
Yeah, we got it. Thanks, Kristen. So again, thanks to Con for the overview. I'll also note that we plan to post a Cal eGrants application user guide to the HRTP healthcare webpage either later this week or early next week. That will kind of provide an overview of a lot of what Con just presented. But in spite of the guidance, there does tend to be issues here and there, especially for new users in the Cal eGrants system. So we do want to emphasize that we are available and ready to assist if you do run into any issues. The most common of which is the need to reset a password, particularly if your organization has already registered in the Cal eGrants system and you haven't been in the system for a while. In order to request a password reset, please email us at that same email that was posted earlier. That's the word solicitations@cwdb.ca.gov. Send us your full name and email address as they appear in the Cal eGrants system. We'll try to get to those same day, but it may take up to 1 business day to process password resets. And those reset links are active for 24 hours. And if you're going through the system and you receive an error, oftentimes it's just a small user error that we can help address pretty quickly. Occasionally, there are system bugs that we need to escalate to our developers. Please, if you're running into errors in the system, send us screenshots of the error message that you're receiving. That will help us address the issue quickly and find a resolution for you. Again, timeline on that is roughly a business day or so. And it's in small text here. It should be in gigantic text. Please remember to save your work. As Con mentioned, there is an auto logout function in the system. And there's nothing more frustrating than spending an hour or two on answering narrative questions and getting auto logged out. The system does not automatically save responses as they're entered. So please click the save button early and often as you're completing your application. And we'll move into scoring rubrics, and I'll pass it to Courtney.
Thanks, Mike. So we're gonna dive into the application scoring rubrics a little bit. Here's the overview. The first one's of the planning and development, and then the second is for implementation and expanding. All applications will be evaluated and ranked in accordance with the criteria and point scale outlined here. These tables provide an overview of the scoring categories and total points available by section that will be used during the CWDB's application process. For technical review, all submitted applications will be subject to an initial round of review for adherence to and alignment with HRTP HC program requirements. Prior to the CWDB's application scoring process, all applications will be reviewed for applicant eligibility, MOUs for training, implementation, and expanding projects, or letters of support for planning and development projects, registration with the Attorney General's Registry of Charities and Fundraisers. Applications that do not meet the above criteria will not be scored. Communication of award decisions. So all applicants will receive an emailed communication of their award decision to the primary point of contact identified in their application following the conclusion of the application scoring process. Awarded grantees must respond via email to solicitations@cwdb.ca.gov within 3 business days to confirm acceptance of a grant award. Applicants that do not confirm their award within the timeline may be subject to forfeiture of award. The CWDB will also post a list of awarded projects to its website following the conclusion of the award process. For the acceptance of award, upon confirmation of acceptance of their award, awarded applicants agree to complete all exhibit modifications identified by the CWDB within no more than 30 calendar days, unless otherwise specified by CWDB. Failure to complete requested exhibit modifications in accordance with the timeline and specifications conveyed to the awarded applicant by CWDB may result in revocation of a grant award. Awarded applicants also agree to comply with all guidelines and stipulations outlined in the RFA, all terms in the grant agreement, and all administrative and reporting requirements communicated by the CWDB at any point in the designated grant term. The CWDB reserves the right to revise the terms and conditions of HRTP-HC awards throughout the grant agreement execution process and grant term. Application exhibit modifications. Following the award notice and prior to the grant agreement execution, the CWDB's Program Implementation and Regional Support Branch will work directly with the point of contact listed in the application to initiate the modification process. During this stage, awarded applicants will be required to update their application exhibits. This process is time sensitive and requires responses to all emails and the return of all paperwork promptly to authorize funding and begin project activities by the program start date. The grant agreement process and timeline. CWDB partners with EDD to process and execute grant agreements following the award process. The grant agreement process begins with CWDB program staff contacting awarded organizations to make necessary edits to application exhibits. Awarded applicants are expected to respond and make requested edits promptly. Once requested edits are made, the CWDB will submit relevant documentation to EDD for grant agreement processing. Any changes to an organization's contact information as identified in their application at any point during the grant cycle, including primary and fiscal points of contact, must be communicated to the CWDB immediately. Failure to provide valid and current contact information and/or failure to respond to CWDB requests for information may result in revocation of a grant award. And I will pass it back over to Mike.
Thanks, Courtney. So we briefly wanted to introduce our phenomenal equity, climate, and jobs field branch. Awarded grantees will be assigned a field specialist from the team to work with them starting at the beginning of the grant term. And before I go on, I think I saw Sandra on the call. Sandra, do you want to introduce yourself and speak a little bit about the ECJ team?
Great to be with all of you today. My name is Sandra Hamame, and I'm the team lead overseeing the incredible field team here at the CWDB. And I know that 4 of our team members are on the call: Paul Aguirre, Jesse Flores, Nick Escobar, and Janice Rustin. Those 4 field specialists have healthcare HRTPs in their portfolio and will likely be one of the field specialists assigned to awarded projects. We have an extended team also that works directly with UC Berkeley Labor Center as part of our community of practice. Amanda Hanna is a liaison. She's not on the call, and Monique Anderson. Both are outreach coordinators that help support the team and support HRTP projects. So thanks for the chance to introduce the team. Mike, I'll turn it back over to you.
Thanks, Sandra. And I just want to correct the record. That beautiful map that was shown at the top of today's presentation, that was one of our field team specialists, Paul Aguirre. That's a great tool, and I would encourage folks to check that out when they have the time. So looking at timeline for the HRTP healthcare grant, the RFA was released this past Monday. Today's the webinar, obviously. We are going to be hosting 2 additional meetings. They're not going to be quite as formal as today's webinar. So this upcoming Monday, for the first time, we are going to be hosting a budget-specific office hours. In office hours, we use that term. These are more sort of open format calls for folks who have questions about the application process to join us and flag questions or issues that you're having. We want to make ourselves available to applicants and make sure that you're able to navigate the application process smoothly. So again, we'll have the budget office hours this coming Monday at 1 p.m. And then roughly a week before the due date, we're going to host a more general office hours. So at that point, folks are likely going to be further along in the application. And if you're running into issues, again, we'll be available to help out with those. Our Q&A process, which Monique will talk about in a second here, our final Q&A, and these are posted weekly to our webpage. The final Q&A will be posted on Friday, November 8th. The deadline for application submittals is Tuesday, November 12th at 5 p.m. So that's the day after Veterans Day. We expect awards to be announced sometime in January. Contract processing, we work with EDD on processing our grant agreements. That generally takes somewhere between 4 and 6 months. Estimated program start date here is listed as TBD. We don't have a formal program start date at this time. But I will, just to kind of provide, set expectations, given the contract processing timeline. We anticipate programs starting right around July 1st, 2025. And then the grant terms listed here, Monique covered those during the project type slides. Monique, I believe I'm turning it to you.
Yes, so let's talk about our weekly Q&A. Just as a reminder, individual CWDB staff cannot respond directly to any inquiries or engage with potential applicants during this open application period. We are posting a weekly Q&A, as Mike mentioned, beginning October 25th. We have already begun receiving some questions. So as you're reading the RFA, if you do have a question, feel free to email us at solicitations@cwdb. And also it's highlighted here because I know folks be forgetting. Please use HRTP as your subject line when you're asking a question, because we do have another funding opportunity out right now. So it just helps keeps things organized. I believe I'm just going to show what our webpage looks like now and what the RFA looks like. So this is our beautiful page. Shout out to Kristen, who's been working very hard with our communications team to get this up and running. And this is our RFA that also looks beautiful. I'm going to go ahead and reiterate and encourage everyone to come to our office hours. As Mike mentioned, we do have 2 coming up. Our general one will be Monday, October 21st at 1 o'clock. And we will have a special budget office hours on Wednesday, November 6th at 2 p.m.
Those are backwards. Sorry, guys, those are backwards.
Oh, they are backwards. And now the highly anticipated time for questions. So lead it off to you.
So yeah, now's the opportunity for folks on the call. If you have questions for us, we encourage you, if you have questions, use the hand raise function. So you could find that in the bottom toolbar on Zoom. There's a react button. And then once you click react, there's a hand raise bar at the bottom of that menu. Please feel free to use that, and we will queue up those questions and try to respond. We've also been responding to questions in the chat as well. If there's any clarity that folks need on our answers in the chat, please feel free to jump on and raise your hand. And just one caveat for today's Q&A. We'll call this like provisional guidance, because the first Q&A doesn't release until a week from tomorrow. So we want to make sure, given the timeline for the grant, that folks have some direction. But we will make final policy clarifications on these questions in that first Q&A.
All right. Well, thank you guys so much for your patience. I know we've had quite a few questions in the Q&A, as Mike said. I just want to confirm that all these questions will be in our weekly Q&A that's posted to our webpage, and we have put the link in the chat. So every question, whether it be a live question or within the chat, will be added to the Q&A. I'm first going to go through some of the questions that we weren't able to respond to within the chat, and then I'll go ahead and start taking the hand questions. Ready? Jeff Portwood asked, are training providers that aren't based in California eligible to be grant applicants?
That's a good question. I'd like to clarify our policy on that in the upcoming Q&A. So a few questions I may just kind of punt to that first Q&A, and that's one of them, unfortunately. So we will discuss that internally and then provide guidance in next week's Q&A document.
And then Lee asked, can more than one application be submitted? And it was kind of a couple parts to it, so that's why it was a little more difficult to answer in the chat. Essentially, a lead applicant could apply for 2 different programs, as far as you have an expanding grant or a planning and development grant, and they have to have had it has to be 2 different programs that you're implementing. I don't know if you want to add more to that.
Yeah, I'll add to that, Julissa. We are likely to allow multiple applications under the different project types. So no, we're not going to allow 2 applications for the same project type. However, organizations that do submit multiple applications, regardless of how the scoring shakes out, we will only fund 1 application per organization, per lead applicant organization.
And then Kathleen asked, can you apply to a plan, which is the same, can you apply to the planning and development along with training concurrent? So just the same question again, we'll fund one per lead applicant. Can you discuss how, or sorry, Jamie said, can you discuss how if this new grant opportunity aligns or builds with the ELL healthcare pathways of the 3-year grant?
Yeah, I saw that question in the chat, and I love that because that's a great example of the state and federal funding alignment priority that we have for this grant. An HRTP that can demonstrate alignment with the ELL Pathways grant, I think is a really good example of how to align different funding sources for an HRTP application.
And then Jessica said, what if your organization hires employees to support healthcare jobs? Would we still need to partner with an employer partner?
Yeah, I saw a few questions to that effect in the chat. I want to make sure that we choose our phrasing correctly on how we respond. For the time being, I did comment to one of those questions in the chat. So nonprofit entities are eligible to serve as lead applicants. We didn't really address nonprofit employers in terms of lead applicant eligibility serving as an employer. I tend to, I'm going to be careful with what I say. It's very likely that that is an allowable scenario, but I do want to just kind of reiterate that we will give final policy direction on that in the upcoming Q&A.
And the Q&A will begin to be posted on Friday, October 25th. So that'll be next Friday. And I went ahead and added the link into the chat, and you'll be able to find the Q&A that's posted there for everybody to review. And we do ask that you submit your questions by Tuesday at 2 p.m. of that same week. So as we mentioned before, all questions that are asked today will be in the Q&A, as long as anything that we receive up until Tuesday at 2 p.m. will be posted on next Friday's Q&A. All right, I'll start taking, oh, and sorry, Lee, I saw your question about what was backwards. There was the dates for the webinar, or the office hours were mixed. The budget webinar will be on Monday, and Monday the 21st, and the general sorry, I want to say webinar, office hours will be on November 6th. So that was just the mix up of dates that was backwards. So I'll go ahead and start from order. We're going to go ahead with Kim Jones. If you want to go ahead and unmute yourself. Or I can unmute you. That's better.
So my question is, if you're the lead applicant, can you also be a partner applicant on your second application?
If you're a lead,
So
did you hear that?
Yeah, I just want to clarify. Yeah, go ahead.
Yes, so if you're the lead applicant on one application, can you be a partner applicant? That's a totally different program.
Yeah, so the question is, if you're lead applicant for one project, can you also be a partner on a different application? Yes, that scenario would be allowable, provided you're eligible to serve as a lead applicant.
Yes, thank you.
All right. And next is Kathleen Barber.
Yes, thank you. I think you kind of addressed this, but I don't know if I heard it correctly. If you're an employer, a nonprofit employer, can you be a lead applicant?
Yeah, that's the similar question to that one that just came up a minute ago. Again, I want to craft our response carefully. So final guidance will come in the upcoming Q&A. But given our timeline, I will say provisionally, given that organization type is a nonprofit, yes, they would be eligible to serve as a lead applicant.
Thank you.
Thank you, Kathleen. And next up is Lee.
Hey there. Well, first of all, thank you all for doing this. But I have to ask the question, is there any possibility to get another week on this?
Yeah, we're very much sensitive to the fact that the turnaround here is pretty short, given the application. Our timeline is driven by being able to get final grant contracts into processing before EDD's contract processing deadline in late February. And so we internally are on a bit of a tight timeline to just get this funding out to the folks in the field. So we're gonna have to hold the line on the due date, unfortunately. Um, but we do, again, like we want to be available to assist folks in getting all the information they need to get those applications in by the deadline.
Thank you. I tried, guys.
Yeah, sorry.
You got an A for effort there. Thank you. All right, Helen, you're up next.
I have a question about the match. Is if the employer is paying the salary of the people while they're in the training program, is that considered a match and leverage? And if we're dealing with a bunch of different employees, can we come up with a general match, or do we have to have a match for each individual MOU signer? It would be a lot easier to come up with some sort of general amount, but do we need to make it specific to each, in this case, school district?
I'll take the second question first. There is an exhibit in the application, the partner roles and responsibilities, where the match is there's a prompt to sort of itemize the match by partner. Um, uh, I don't think the application as it's structured really well, I should say this. On the cover page, there is just a general line item for identifying the total match amount. So we're not going to screen the match in the partner roles and responsibilities as like something that would be like a disqualifying element. As long as there is a match there, I mean, that will have to be substantiated during the sort of award phase. Um, but I think there is some flexibility to have a more generalized number for the match leverage. Um, and sorry, Helen, can you remind me what your first question was?
So for example, in the MOU letter, the employer could say, we will provide the salaries without being specific about what those are. So that would be because they will differ over, but they will still agree in the MOU, they're going to provide the salaries to the people.
Um,
Would
I'm
that
gonna,
be sufficient?
I'm
Given
gonna,
there's such a short timeline.
yeah, I'm gonna throw my colleague Matt under the bus. Matt, do you have a sense of if that's been an allowable match leverage for past grants?
For like an employer to provide like participant wages,
Yeah.
like during the
Yeah.
thing. I mean, participant wages are a budget line item in there. So if you have that being provided like solely by leveraged funds and is not being done by like your like lead applicant agency, I don't really see why. It would just be that you need to make sure you're hitting that one-to-one match overall.
Oh, yeah, it would definitely. Okay. Thank you very much.
Thanks, Helen. Thanks, Matt.
All right. So we have a couple in the chat. We had a question from Karen asking how many projects do we anticipate will be awarded in each project type category?
As of right now, we haven't identified specific allocations by project type. That will largely be driven by sort of the quality of applications we get for each project type. So the scoring will sort of drive how which projects we fund. But we do intend to make awards for all three project types. We just don't have a definitive number or amount for those different the awards for those different project types.
All right. And Carla, you can go ahead and unmute.
Hi. It looks like Ginny, Jung, and I have the same question. Can you dive deeper into the existing HRTP grantee guidelines? Like, for example, can an existing HRTP expanding grantee apply for an expanding project in HRTP HC and things along those lines? How should we be thinking about that? Thank you.
Carla, just to clarify on your question, are you referring to projects that we're currently funding to come back for additional funding to do the same work or to run an additional, a different project?
If we're already an HRTP grantee, with, say, an expanding or say, an expanding type project, can we apply with this new HRTP-HC as an expanding project or a training implementation project? Or what are the guidelines around existing HRTP grantees applying to these other these new other project types?
It is allowable for existing grantees to apply for this funding opportunity. I will say we will consider how far along, like the progress through the current award that a project is when they apply. So if a project is sort of like in the first few months of their existing award, um, it's probably less likely that we would fund a project under that criteria. If there's a project that is wrapping up and will be close to the end of their grant term by the time of this grant's start date, that type of project is more likely to receive funding consideration. And we'll clarify that policy in terms of what amount of progress existing grantees should reasonably be expected to have advanced through to be considered for funding. But as a general rule for now, before the Q&A comes out, I will say there's no exclusion for existing projects to apply for this opportunity.
Thank you for your question. All right, you're up, Arthur.
Hello, good morning. So you used the LVN to an RN incumbent worker training as an example. I a few years back did some incumbent worker training in exactly that scenario, and the LVNs when they went into training had to cut their hours to part-time. Is that allowable under this grant?
It's not explicitly not allowable. I think the details would come into play a lot, and that would be incumbent on the applicant to articulate how the project would address that. Um,
So they actually did work part-time, but they had full benefits. They were still considered full-time employees, but they were attending school and they couldn't do both full-time.
yeah, it's not that type of scenario isn't not allowable. Again, it's kind of tough for us to comment on specifics about an individual project's design at this point. Um, and I would just encourage applicants to kind of articulate how their project will, drive equity and make sure that participants are kind of getting the benefits and the support that they need to advance through training.
Okay, thank you.
All right, so we're getting a couple questions in the chat. Give me a second. Lee is asking if direct care workers refers to allied healthcare workers like medical assistants, patient care reps, and techs, etc. I want to say yes.
Yeah, I would point that individual to the description of that occupational priority in the RFA. There is a little more context in the RFA document. If there's a more specific question after reading that section of the RFA, we're certainly willing to connect with our partners at LWDA and HCI to be more descriptive about that priority if needed.
And all of that can actually be found on page 8 of the RFA, just for your reference. And Helen has, I'll go ahead and let Arthur ask his question.
So I'm working on a project right now, just at the very early stages, but it involves people that work in hospitals, are members of labor unions, but they're not direct care. Would that be allowable?
Yeah, it would certainly be allowable. If the question is whether that would meet the that particular occupational priority, That's another one where I think it would really depend on the context and how that's described in the application. But again, just encourage everyone to review those priorities in the RFA and speak to your proposal's alignment with those priorities if there is alignment.
Okay, thank you.
I do want to hit Julissa. I want to hit Carlos' question about the climate change requirement for this grant. So there is a narrative question that prompts applicants to respond to how their project will um, entail a environmental sustainability component. That's another one where I would certainly encourage folks to review the environmental sustainability subsection in the RFA. We tried to provide some examples of how environmental sustainability can be applied in a healthcare context. And I'll note that that question is optional because we understand that whereas HRTPs and other sectors have a clearer connection to environmental sustainability, it still is one of the essential elements of high road. And we certainly encourage projects in the healthcare sector to consider ways in which their projects could align with that element of the high road model.
And pages 10 and 15 review that a little more deeply for your guys' reference. Arthur, did you have another question?
I'm sorry, no.
Okay, just double checking. Okay, Haley, go ahead.
Hi, I just have a technical question. Sorry if this was already covered and I missed it, but to begin the application in the portal, I'm noticing that you have to kind of fill out that template in the beginning that has your application category and your amount of funds requested. But there's no way to actually see the application until you complete that. So my question is, are you able to go back and change that information once you've gotten into the application? Like your amount requested might change once you can go through and create the budget, or you might switch from a planning development to a training, like you might switch once you can actually get in and see the application. Is that feasible?
Yeah, thanks for the question, Haley. So one of those two things can be changed. The actual application for the planning and development project type and the training implementation and expanding project types are slightly different. So once you select your project type, you're unable to change that. You would have to start a new application. Requested award amount can be changed. So I would definitely encourage anyone who's struggling with which project type to start an application under. Read the project type descriptions in the RFA carefully and kind of choose wisely. Otherwise, like I said, if you change project types, you will have to start a new application.
Okay, thank you.
Right there. All right.
So I think this is my last question. Regarding the two general office hours on the 21st and the 6th, are you going to send automatically links for those meetings?
So we're not going to send those links out. Those are on our webpage, and I think if someone on the team can drop those registration links in the chat, we'll be wrapping up here in a couple minutes. So if you're quick and you can get to those links in the chat, feel free to use those. But also, again, the HRTP healthcare webpage off the CWDB website has those links.
Okay, thank you.
All right, we're just at about time here. There's time for one or two more questions if folks have one. Otherwise, we can wrap up. All right. Well, like we mentioned, if questions pop in your head either later today or throughout the next few weeks, we are available at solicitations at cwdb.ca.gov to respond to those questions, include them in the Q&A. I'll note if you have like a Salesforce issue, or, excuse me, a Cal eGrants issue, those do not need to wait for the Q&A. We will try to help you out as soon as possible. But questions that are more along the lines of policy clarifications, those do go in the Q&A document, which again will be posted on the HRTP healthcare webpage. So I want to thank you all for joining today. We're really excited to be able to provide this funding opportunity to you all. Very excited to see the applications and fund some of the great projects that we know you all are working on right now. So thank you very much and have a great day. We'll see you all at office hours on Monday if you choose to attend. Thanks a lot.